Hi, I'm going to share with you the 9 complications to watch out for if you have an indwelling pleural catheter (IPC) in your chest. You need to see a doctor at the emergency department immediately if you experience any of them. 1. Infection at the site where the catheter is inserted. The skin around the site should look clean or nearly normal. If you notice redness, swelling, pus or blood, experience pain or fever, it could mean that the site is infected. To prevent infection, change the dressing at the site every 7 days or sooner if it is wet, loose or dirty. And always wash your hands thoroughly with soap and water or hand sanitizer before and after handling the catheter. 2. Severe discomfort or pain when draining the fluid. A little discomfort is normal, but it should not be intense. Try to manage the mild pain by slowing the drainage or stop it completely until you feel more comfortable. 3. Feeling short of breath even after draining 1000 milliliters of fluid in a day. Remember, you should not drain more than 1000 milliliters of fluid a day. 4. Unusual color, consistency or smell in the drained fluid. Stop draining if you notice that the fluid turns bright red, cloudy or smells very bad. The fluid should have a straw color, which is a clear light yellow color. Sometimes it's pinkish yellow when there's a bit of blood in the yellow fluid. It should either be odorless or have a mild smell. 5. Leakage around the insertion site of the catheter. Check your dressing daily, even if it's not the time for dressing change. Some fluid leakage is normal, but it's not normal if there's leakage of pus or blood. 6. Fluid does not drain into the drainage bottle right from the start of the draining session. Go to the emergency department when there's still no fluid drainage, even after you have tried these 4 fixes. 1. Straighten any bends along the catheter and drainage line of the drainage bottle. 2. Make sure that the drainage line of the drainage bottle is securely connected to the catheter. 3. If you are using this type of drainage bottle, make sure that both the white clamp and the slider of the drainage bottle are in open position. If you are using this type of drainage bottle, make sure that the support clip has been removed from the top of the bottle. The T-plunger has been pushed downwards to puncture the foil seal and that the roller clamp is open. 4. If you are using this type of drainage bottle, make sure that the bottle indicator is depressed and not raised. The 7th type of complication is a sudden stop in the flow of fluid during draining. When this happens, try the 4 fixes mentioned earlier in this video. If these fixes don't work, try these 3 other ways. 1. Gently roll the catheter between your fingers to loosen the obstruction of any debris. 2. Make sure that the bottle indicator is not fully raised. 3. Replace the bottle. If the fluid still does not drain even after you have done all these fixes, go to the emergency department. 8. Catheter is damaged. But to prevent this, do not use any scissors or sharp objects near the catheter. If you accidentally cut or make a hole in the catheter, pinch the catheter between your fingers and slide the blue clamp over the catheter above the damaged area. Then, seek help from your nearest emergency department. And 9. The catheter is pulled out or the cuff becomes exposed. In this unlikely event, cover the insertion site with a gauze dressing to stop any bleeding or leakage and head to the nearest emergency department. The catheter has a white cuff which is inside the body and should not be seen out of the body. The cuff and stitches keep the catheter in place. The stitches will typically be removed in 1 to 2 weeks' time. Remember these 9 complications and seek medical help at your nearest emergency department if you experience any of them. That's all. Thanks and bye!